Reporting. All first aiders should have sufficient oral communication skills to make an accurate verbal report about the incident. This should be a quick and efficient handover to personnel taking over the casualty so they can provide the appropriate further treatment as soon as possible. Although the initial report is done verbally, it can be useful to also do a written report. First aiders should try to make notes where possible during first aid provision or fill out official report forms soon after. Recording treatment and events will assist with recalling what happened if ever required to do so. Keep in mind, however, that all written information about a casualty must be kept private and confidential, unless the casualty agrees to share the information or authorities require it for legal purposes. Official incident report forms need to be filled out and kept on record for all incidents, regardless of whether there was an injury or not. Forms must be accurately filled out in accordance with the workplace policies and procedures, legislation, and privacy and confidentiality requirements, stating only facts, not comments that you are not qualified to make judgment on. Evaluation. You must be aware of your own skills and limitations whilst providing care for a casualty. Evaluating your own performance after an incident can provide you with an opportunity for self-improvement. It may be beneficial to speak with the paramedics who attended the incident to ask for advice. It is extremely important to recognise the possible psychological impacts on yourself, other rescuers and children, especially when involved in a critical incident. Debriefing should be conducted to address individual needs, and children should be provided with someone to talk with about their emotions and responses to events. All first aiders should talk about the event and how they feel and seek professional help if they recognise the signs and symptoms of stress. In a workplace, evaluation of an incident should be done with the supervisor and all involved so the incident can be discussed, evaluated and recorded for future improvement. Dangers and safety precautions. Before providing first aid, a first aider must evaluate the scene of an emergency on approach using hazard identification. If hazards have been identified, it is important to assess the risk that they pose. This is called a risk assessment. The step is to decide what to do, to remove the risk posed by the hazard or make them safer. Examples of hazards include aggressive behaviour, needle stick injuries, chemical fluids, traffic and more. You must be aware of possible injuries you could receive whilst providing first aid. People move and have characteristics that must be taken into account when moving, lifting or assisting casualties. The shape of our spinal column, which curves forward in the neck and lumbar region, means that these areas receive the greatest stress when moving or lifting. The majority of back injuries occur in the lower lumbar area. Avoid using back muscles to lift a casualty, and most importantly, never lift a casualty whilst you're bent over them. In every first aid situation, you should try to minimise the risk of transmission of infection to yourself, the casualty, and to any bystanders. Follow standard precaution procedures to ensure a basic level of infection control, especially when handling blood or body substances. Standard precautions are practices that are applied regardless of the casualty's infectious state. Ensure that where available you use and dispose of gloves before, during and after first aid.